The world knows Billy Joel as the Piano Man. His songs have provided the soundtrack to countless lives. For decades, his energy on stage has been infectious. So, when news broke about his recent health battle, fans around the globe felt a wave of concern. Many had noticed subtle changes during his recent performances. His movements seemed a little different. His usual spark, while still there, seemed to carry an unspoken weight. It was in early May 2025 that Billy Joel bravely shared his diagnosis. He revealed he is facing a condition called Normal Pressure Hydrocephalus, or NPH. This is a neurological disorder that affects the brain. The diagnosis explained the changes fans had observed. Following his diagnosis, Billy Joel made the difficult but necessary decision to postpone his tour. This break is essential for him to undergo medical procedures. His wife, Alexis Joel, rightly stated that his health has to take priority. At 75 years old, after an incredible and demanding career, focusing on his well-being is paramount. Fans have shown overwhelming support. They understand the need for this pause. Billy Joel's situation, while personal, has a broader impact. It shines a much-needed spotlight on normal pressure hydrocephalus. His story is a powerful catalyst for awareness. So what exactly is normal pressure hydrocephalus? Let's break it down. The term hydrocephalus itself means water on the brain. In NPH, this water is actually cerebrospinal fluid, or CSF. This vital fluid surrounds and cushions your brain and spinal cord. Normally, CSF circulates through cavities in the brain called ventricles. It is then absorbed into the bloodstream. This process maintains a delicate balance. In individuals with NPH, this balance is disrupted. Excess cerebrospinal fluid accumulates in the brain's ventricles. These ventricles then enlarge because of the extra fluid. Think of it like a plumbing system where the drain is partially blocked. This buildup can put pressure on surrounding brain tissue. The normal pressure part of NPH can be a bit misleading. It means that when doctors measure the intracranial pressure, it's often within the normal range or only slightly elevated. NPH typically affects older adults, most commonly those over the age of 60. In many cases, the exact cause is unknown. This is called idiopathic NPH. Sometimes NPH can develop after a head injury, brain surgery, a stroke, or meningitis. Understanding its nature is the first step towards recognizing it. Normal pressure hydrocephalus is often characterized by a distinct set of 3 core symptoms. Healthcare professionals frequently refer to this as the NPH triad. To make it easier to remember, they use the mnemonic wobbly, wacky, and wet. Each of these terms points to a specific type of difficulty. Recognizing this pattern is key to suspecting NPH. These symptoms tend to develop gradually. They can significantly impact a person's quality of life. The wobbly aspect refers to gait disturbance. Individuals with NPH may find it difficult to walk. Their steps might become short and shuffling. They may walk with their feet wider apart for balance. Turning can be particularly challenging. Some describe their legs as feeling heavy or stiff. This unsteadiness can lead to an increased risk of falls. Wacky is a colloquial term used to describe cognitive decline. Memory problems, particularly with short-term memory, are common. Finally, wet refers to urinary incontinence. This involves a loss of bladder control. The combination of these 3 symptoms, gait problems, cognitive issues, and urinary incontinence, should raise a red flag for NPH. Their presence together is highly suggestive. Diagnosing normal pressure hydrocephalus can be quite a complex puzzle. One of the biggest challenges is that its symptoms aren't exclusive to NPH. They overlap significantly with other conditions common in older adults. Forgetfulness is often attributed to simply getting older. This overlap makes it easy to overlook NPH as a possibility. Families and even doctors might initially dismiss the signs. They might think it's just a natural part of aging. NPH is frequently misdiagnosed as other neurological conditions. Alzheimer's disease is a primary example, especially due to the cognitive symptoms. Parkinson's disease is another common misdiagnosis because of the gait disturbances. The gradual onset of NPH symptoms further complicates the diagnostic process. The changes usually don't happen overnight. They creep in slowly, over months or even years. Family members may adapt to these slow changes. To make an accurate diagnosis, doctors need to have a high index of suspicion for NPH. Brain imaging, such as an MRI or CT scan, is crucial. These scans can reveal enlarged ventricles, a hallmark of NPH. A lumbar puncture or spinal tap can be both diagnostic and prognostic. The most encouraging aspect of normal pressure hydrocephalus is that it is often treatable. With NPH, there's a real possibility of reversing or significantly improving the symptoms. The primary goal of treatment is to drain the excess cerebrospinal fluid from the brain. By reducing the volume of CSF in the ventricles, the pressure on surrounding brain tissue is lessened. This can allow the brain to function more normally again. The most common and effective treatment for NPH is a surgical procedure to implant a shunt. A shunt is essentially a small, flexible tube with a one-way valve. One end of the tube is placed into one of the brain's ventricles. The other end is typically placed in the abdominal cavity or peritoneum. The shunt system allows the excess CSF to be diverted from the brain. It then gets absorbed into the bloodstream from the abdomen. Shunt surgery can lead to remarkable improvements in NPH symptoms. Studies have shown that up to 80% of carefully selected patients experience significant benefits. Gait disturbances often show the most substantial and quickest improvement. Cognitive function and bladder control can also improve, though sometimes more gradually. The degree of improvement can vary. Despite potential complications for many individuals with NPH, the benefits of shunt surgery far outweigh the risks. It can restore a significantly better quality of life. Billy Joel's recent announcement about his NPH diagnosis has undeniably thrust this condition into the international spotlight. As a beloved musician with a career spanning decades, his personal health journey resonates with millions. His decision to be open about his struggles is an act of courage. For months, some devoted fans had noticed subtle differences in his stage presence. His revelation provided an explanation. It also transformed him into an unintentional advocate. His fame provides a unique platform. This platform can educate and inform a vast audience. The news that he would postpone his tour underscored the seriousness of his condition. He needs this time for the necessary medical interventions and subsequent rehabilitation. His team has indicated that he is expected to make a full recovery. He plans to resume his touring schedule on July 5, 2025. This timeline offers a hopeful outlook. It demonstrates his commitment to addressing his health head-on. His wife, Alexis Joel, has been a pillar of support during this challenging time. Her public statement emphasized that Billy's health has to take priority. Her words highlight a universal truth. Health is our most valuable asset. When public figures like Billy Joel share their personal health battles, it has a powerful ripple effect. It significantly raises awareness for conditions like NPH, which many people may never have encountered. Billy Joel's story can serve as a crucial wake-up call. Billy Joel's experience with normal pressure hydrocephalus brings a vital message to the forefront. Early diagnosis of NPH is absolutely critical. The sooner this condition is correctly identified, the better the potential outcomes from treatment. Interventions like shunt surgery are generally more effective when performed in the earlier stages of the condition. If symptoms have been present and progressing for a very long time, some of the damage to brain tissue may be less reversible. Therefore, it's so important not to dismiss the wobbly, wacky, and wet symptoms. They should prompt a medical consultation. If you or someone you care about is experiencing this triad of symptoms, gait problems, cognitive changes, and urinary issues, please see a doctor. It is important to specifically ask about normal pressure hydrocephalus. Be an advocate for your own health or for your loved one. A correct and timely diagnosis can make an enormous difference. It can be the key to unlocking effective treatment. For many, it can mean reclaiming mobility, cognitive function, and overall quality of life. Don't hesitate to seek a second opinion if you feel your concerns aren't being fully addressed. It's also worth noting the advocacy work of Alexis Joel. She has previously spoken openly about her own personal struggles with endometriosis. Her unwavering support for Billy during his NPH journey is evident. Her public voice also highlights the importance of research, awareness, and support systems for various medical challenges. As of today, May 24, 2025, Billy Joel is on his path to recovery. His journey is a powerful reminder for all of us to listen to our bodies.